Subscribe to our channel, press the bell icon and never miss an update from Latestly.
We have a positive case of COVID-19 in the community. We will not be in a position to identify if this is a case of the Delta variant of COVID-19 until genome sequencing is returned tomorrow. However, every case we have had in MIQ recently has been the Delta variant of COVID, and Delta is surging around the world. While we cannot confirm it yet, we need to assume that our case will be too, and that has shaped all of the decisions we have made this afternoon. Public health officials have been working at pace this afternoon to gather information on the case and their movements, and I will pass to Dr. Bloomfield shortly to set out the facts as we currently know them, including locations of interest that have been identified so far. But first, I want to assure New Zealand that we have planned for this eventuality and that we will now be putting in place that plan to contain and stamp out COVID-19 once again. Going hard and early has worked for us before. While we know that Delta is a more dangerous enemy to combat, the same actions that overcame the virus last year can be applied to beat it again. We are in the position to learn from experience overseas and what actions work and what actions don't work. On that front, Delta has been called a game changer, and it is. It means we need to again go hard and early to stop the spread. We have seen what can happen elsewhere if we fail to get on top of it. We only get one chance. That's why Cabinet has met this afternoon and made the decision that New Zealand will move to Alert Level 4 from 11:59 p.m. tonight. Level 4 will be for an initial period of 3 days, except for Auckland and the Coromandel Peninsula, who we anticipate will likely be at Level 4 for 7 days, due to them being most closely linked to our current case. Over this time, we will be looking for testing results from people from locations of interest, wastewater testing, and general community testing of those with cold and flu symptoms elsewhere in the country. Our plan over the coming days is assess if there are undetected chains of transmission elsewhere to track down the source case and to assure ourselves that there aren't other cases in the community elsewhere. We have made decisions on the basis that it is better to start high and go down levels rather than start too low, not contain the virus, and see it move quickly.